shows the repositioning of the uterus and rope apply. It is a case of buffalo died due to prolapse of uterus. Any delay in treatment leads to the lacerations and hemorrhages and leads to visceral shock. Prolapse of uterus. It is a condition, it will occur in any species of animals, especially buffaloes, cattle, rarely sows and mares also. The major cause for the prolapse of uterus is in milch animals like buffaloes and cows. The major cause is retention of placenta or retention of fetal membranes. The second is lack of physical exercise to the animals in stall feeding animals especially. Third is hypocalcemia. The other causes is uterine atony due to calcium, phosphorus, and magnesium deficiency, and also selenium, vitamin E deficiency also cause contributory cause for this prolapse of uterus. Sometimes uneven slope at the restraining uneven slopes at standing place of the animal or resting place of the animal, especially down slope at hindquarters and high slope at fore, forelimbs quarter leads to cause for one of the cause for prolapse of uterus. And also excess estrogen levels in the blood also cause prolapse of uterus. It is a main contributory cause for the prolapse of uterus. Those are, and also sometimes excess concentrate feeding, and also sometimes constipation leads to prolapse of uterus. Prolapse of uterus invariably occur immediately after parturition or within 36 hours parturition only. But prolapse of vagina occur any time of the before parturition or after parturition. Sometimes in heifers also prolapse of you may see prolapse of rarely you may see prolapse of vagina. Hereditary sometimes causes prolapse of vagina and also prolapse of uterus. Whenever animal showing prolapse of vagina, in those animals high incidency after parturition it will show prolapse of uterus also. After parturition in animals there is a decreasing in the level of calcium in the blood leads to uterine atony. During expulsion of fetal membranes, animal shows some straining that will cause invagination of uterus. The treatment for prolapse of vagina: first, you should carefully remove the placental membranes or detach the placental membranes from the uterus. Next, thorough cleaning of endometrium. You gently push the uterus and also repair any lacerations inside occurred during course of the prolapse of uterus till it reaches the same position. By gentle pressuring, replace the prolapse of uterus into the same place. Hand should be inserted deeply and reposition the prolapse of uterus till tip of the uterine horn reaches the inside the abdomen. Invagination is complete. Reposition is necessary. During pushing time, you should give oxytocin to be sure there is no remaining invagination in the abdomen. Some parts of the invagination may lead to abdominal straining, and relapse of prolapse of uterus is very common. After repositioning, you should inject 5 to 10 international units of the oxytocin. It will increase the uterine tonicity. During prolapse of uterus, sometimes animals show shock. Sometimes uterus may damage to the laceration and hemorrhages, extravasation and extensive hemorrhages. Sometimes thromboembolism. Before repositioning of the uterus, you should completely evacuate the urinary bladder. Whenever urinary bladder is filled, it is impossible to repositioning until the evacuation of urine from urinary bladder. Remove the urine through catheter or by needle puncturing through the uterine wall till bladder. It is a commonly seen in rural condition. This treatment under field condition only, but you should take care. Use gloves and apron. It is a field condition, but it is be sure animal is not having brucellosis, and after thorough cleaning washing is for safety of the doctor. It is a common mortality seen after parturition.